Hi everybody, welcome to another MESOP Digital Partnership Day. There's lots of videos for you to look at today whilst we're still trying to keep these events going. We're having to run them digitally for the time being, but we're really looking forward to being able to get back together in person again. And those things are starting to happen, but obviously we need to be as safe as we possibly can without having to cancel these sorts of events. The other context that we've got at the moment is the incredible pressure that we're under in services at the moment, and I really wanted to acknowledge that for everybody today, that I appreciate how difficult and how pressured things are. I recently wrote to all of the clinical staff across the directorate just to give you a bit of an update about what we're doing from a management perspective to try and tackle some of those pressures and staffing shortages that we've got, the different initiatives that we've got, the recruitment campaigns that we're undertaking, and really just to give you the reassurance that we're working very hard and that we hear from you how difficult things are, and we're really trying very hard to support you. The main thing that I want to say around that is a thank you. I don't think it can be said enough, really. I truly do appreciate how hard everybody is working. I hear really touching stories about the real care and compassion that our staff show towards our patients and their families and carers. And I really want to say a huge thank you to everybody across all of our services, across all of our professional groups, for all of the work that you're doing at the moment to keep our patients safe and well cared for. So just a really brief update on some of the transformation work that we've got going on. As you know, the long-term plan transformation continues in earnest. So there's the SMI, or the severe mental illness pathway transformations that are happening. And actually there's a bit of an opportunity at the moment for us to take a bit of a pause, a bit of a review, and to really consider about what those pathways that we've been redesigning look like and whether they're the right design for our older adult population. There's been some debate and discussion around the accessibility of those pathways and whether they're quite right just yet. So really looking forward to starting to have those conversations across the two directorates, across adult mental health and mental health services for older people, to really make sure that we've got the offer right for older adults in the community and also within our inpatient and liaison settings as well. There's also a fair amount of activity around our dementia pathway and really starting to look at how we embed that design. So as you know, we've done the MAS review and the recruitment into MAS. We're starting to see real pressure in terms of the referral increases for dementia diagnosis, not just within memory assessment for older adults, but also within our younger onset service as well. So we're going to be taking some time to really review and evaluate where we're at with things and make sure that we get it right for the longer term. As you know, the Millbrook redesign work is ongoing. You'll be aware there have been some delays in the programme. There'll be more information about that available over the next few weeks, so that we can all be clear on the timelines that we're working to, particularly as it affects staff up in Bassetlaw as well. The community work to relocate the community teams up in Bassetlaw continues, and again, you know, we'll get more information around those transformations and moves as the information comes through, and we'll make sure that you're updated, and there will be some engagement events, some Q&A sessions that will be being arranged, so keep your eyes open for those, and if you do have any questions, feel free to speak to your service manager and they'll be able to give you the most recent updates for those as well. Cherry Ward refurbishment is also on our agenda. We're starting to look at the design of Cherry Ward in terms of getting rid of the dormitories and moving over to single bedroom ensuite accommodation. So the The Partnership Day today has got a focus on looking at our equality, diversity and inclusion strategy, thinking about safer staffing and getting a bit of an update from Matt Hammond. And also, there'll be some information for you to update you and try to attract you into the Clinical Effectiveness Forum. It's a really important forum that we really want to increase clinical staff engagement in. There'll also be some opportunity during the videos and the Partnership Day sessions for a bit of fun as we're approaching Christmas, and it's time to sort of take stock of things for sure, but also to try and take a bit of time to have a bit of fun, a bit of laughter. So those will be a feature during the Partnership Day as well. Please take the time to enjoy, watch the sessions at your leisure when you've got a time to do that, and give us some feedback about them so that we can make sure these events are what you need. Finally, thanks very much and enjoy the sessions.